So hello students, our today topic is jaundice. So other name of jaundice is icterus. What is jaundice? Jaundice is characterized by yellowing of the skin, mucous membrane and the sclera. So in cases when the serum bilirubin level is greater than 3 milligram per deciliter, it is indicative of jaundice. So, for exam point of view, you just remember that serum bilirubin level greater than 3 milligram per deciliter they are considered abnormal and indicate jaundice. So, the yellowing of sclera, that is the white part of eyes that occurs in jaundice, it is due to the buildup of bilirubin in the blood. So, this bilirubin it is produced when RBC are broken down, and it is a normal process by liver and excreted in bile. But if the liver is not functioning properly, this bilirubin can accommodate in the blood and tissue that can cause jaundice. So as the sclera, it is a thin and translucent tissue. That is why it is more prone to showing this yellow discoloration in the case of jaundice. So the yellowing of sclera is the first sign of the jaundice. So remember, the first sign of jaundice is the yellowing of sclera. So while evaluating a patient with the jaundice, you have to just ask the patient to look down in assessing the degree of yellowing of sclera. So why the patient is said to look down? As the lower eyelid it moves down. The lower eyelid moves down when the patient looks down. So it can provide a clear view of the sclera. So you can take medical history, physical examining the patient, go for laboratory test, or do imaging test, or may send patient for the imaging test like ultrasound, CT or MRI, or liver biopsy can be done. So during a physical examination, jaundice it can be identified by yellowing of the skin and eyes. Uh, Other thing is the presence of dark urine. This is due to the presence of bilirubin in the urine, or pale stools. Stool may appear light or gray in color due to lack of bilirubin. Itching. Jaundice can cause generalized itching due to accumulation of bile salts in the skin. If the jaundice it is caused by gallstone, there may be abdominal pain. Now let us discuss the various types of jaundice. So what are various types? There are three main types of jaundice: prehepatic jaundice, hepatic jaundice, and post-hepatic jaundice. So let us try to understand these three. The first is the prehepatic jaundice. This type of jaundice occur when there is excessive breakdown of RBC. So when there is excessive breakdown of RBC, there will be increased production of bilirubin. So this the liver it is unable to process the bilirubin efficiently, and it causes the bilirubin to build up in the blood. So due to the excessive breakdown of RBC, there is increased production of bilirubin, and this bilirubin is built up in the blood. The causes of prehepatic jaundice they are hemolytic anemia, sickle cell anemia, or the thalassemia. The second is the hepatic jaundice. So this type of jaundice it occurs when there is problem with the liver that it prevents from the processing bilirubin effectively. So diseases like liver disease like cirrhosis, hepatitis, and the liver damage caused by alcohol or the drugs. The third is the post-hepatic jaundice that can occur when there is blockage in the bile duct. So due to the blockage in the bile duct, that will prevent the bilirubin from being excreted from the body. The causes are gallstone, pancreatic cancers, and tumors in the bile duct. So the first was prehepatic jaundice. The causes can be number one, the hemolytic anemia. So here the body will destroy the RBC cells at a faster rate than it can produce them. Second, malaria, that is a parasitic infection that can cause destruction of RBC, leading to increase in the bilirubin level. The third is the Gilbert syndrome. So what is this Gilbert syndrome? It is a genetic disease in which a liver is unable to process the bilirubin effectively, that leads to accumulation of bilirubin in the blood. Fourth, Crigler-Najjar syndrome, in which that affects the liver ability to process bilirubin, that leads to accumulation of bilirubin in the blood. Second is the hepatocellular jaundice. So it occurs when there is problem with the liver that prevents it from processing bilirubin effectively. So various factors like that causes liver diseases or liver damage that caused by alcohol or the drugs or hepatitis could be the cause. So two type of hepatocellular jaundice are there. One is acute and other is chronic. Acute occurs suddenly and is caused by viral hepatitis, drug-induced liver injury, or exposure to toxins such as alcohol or the chemicals. The chronic hepatocellular jaundice, it occurs over the long period of time and it is caused by chronic diseases like cirrhosis, chronic hepatitis B, C, or non-alcoholic fatty liver diseases. So in the hepatocellular jaundice, the bilirubin transport within the liver, it is affected. So the bilirubin, it is transferred within the liver by some specific proteins. So these proteins, they are located on the surface of hepatocytes and these are responsible for taking up bilirubin from the blood and excreting it in the bile. Now in hepatocellular jaundice, what you will see, the function of this transporter will be impaired. So that will lead to accumulation of bilirubin in the blood and there will be decrease in the bilirubin excretion into the bile. The third type is the obstructive jaundice that occurs when there is obstruction or blockage in the bile duct that prevents the flow of bile from liver to the small intestine. The cause are the gallstones due to some small stones that are made up of cholesterol or bilirubin can form in gallbladder that can cause blockage. Second, biliary strictures. They are the narrowing or constriction of the bile duct that can be caused by inflammation, trauma. Pancreatic tumors can grow in pancreas and press the bile duct, causing a blockage. Bile duct tumors that grow in the bile duct that can cause blockage. Inflammation of the bile duct even can cause blockage and swelling. So in the obstructive jaundice, when the bile ducts, they are blocked, the bile produced by the hepatocytes, they cannot flow into the small intestine. So the hepatocytes, they continue to produce bile, but this bile, it cannot be excreted in the bile duct. Instead, it comes back up in the liver. As a result of that, the bilirubin and other waste products that are normally excreted in the bile, they accumulate in the blood. So that leads to jaundice. So in the obstructive jaundice, the failure to initiate bile flow is not due to the problem with the hepatocytes themselves, but rather with the bile duct. So the hepatocytes, they continue to produce bile normally, but the bile, it cannot flow into the ducts and it is unable to reach the small intestine. Now other important thing is, what is Courvoisier law? It is a medical observation that states if a patient has a palpable enlarged gallbladder that is associated with the jaundice it is unlikely to be due to gallstone. So the gallstone they cause the gallbladder to shrink. Instead the in large gallbladder it is more likely to be due to the tumor obstructing the common bile duct. Cholangitis it is a bacterial infection of the bile duct that occur when there is blockage such as in obstructive jaundice. So the bacteria will grow and multiply in the stagnant bile that can lead to inflammation and infection. So we can give antibiotic and remove the blockage that is causing the infection. Other is the neonatal jaundice that occurs in newborn. So due to the immature liver of the newborn, it is unable to process bilirubin effectively and efficiently. So this is typically associated with elevated level of the indirect bilirubin. Other is the cholestatic jaundice. This type of jaundice it is caused by disruption in the flow of bile from liver to the small intestine, such as in the obstructive jaundice or the liver disease. So there is this type is associated with elevated level of direct bilirubin and normal level of indirect bilirubin. Now let us discuss the various tests that can be done. Blood test to measure the level of bilirubin and liver enzymes. CT scan MRI to evaluate the liver and bile duct for sign of obstruction, inflammation or tumor. LFT can be done. Viral hepatitis testing can be done. Endoscopic retrograde cholangiopancreatography, that is ERCP. It is a procedure that use a special scope to evaluate the bile duct and the pancreatic duct. Now, as we know that urobilinogen it is a breakdown product of bilirubin that is normally present in the urine. So, suppose the urobilinogen it is absent in urine, so that will indicate obstructive jaundice. So, where the bilirubin is unable to flow through the bile duct and it is not converted into urobilinogen. Other causes include liver diseases or hemolytic anemia. So if urobilinogen is present in urine, that may indicate hemolytic jaundice or normal liver function, where the liver is able to process bilirubin and convert it into urobilinogen. However, it is important to note that presence of urobilinogen in urine does not rule out obstructive jaundice, as there may be some bilirubin that is able to flow through the bile duct and may be converted into urobilinogen. What are the other causes of jaundice? That could be portal cirrhosis. It is a condition where the liver that becomes scarred and damaged due to the chronic liver diseases. Amoebic abscess that is caused due to the parasitic infection that can lead to liver damage and jaundice. Acute alcohol hepatitis, where due to the excessive alcohol consumption, there may be inflammation and damage to liver leading to jaundice. So what is the definitive test for the prehepatic jaundice? So the definitive test for the prehepatic jaundice, it is the measurement of the serum unconjugated bilirubin level. So in the prehepatic jaundice, there is excess of unconjugated bilirubin due to the increased breakdown of red blood cells, and that results in increase in the serum unconjugated bilirubin level. So other test we can do is there is elevated reticulocyte count, decreased heptoglobin level. A peripheral blood smear may be performed to detect the presence of fragmented red blood cells that may suggest hemolysis, or a direct anti-globin test to evaluate for autoimmune hemolytic anemia. So in the hemolytic anemia, the total bilirubin level they are usually elevated with the predominance of unconjugated bilirubin. So what are the total bilirubin level? The total bilirubin level is the sum of the both conjugated and the unconjugated bilirubin in the blood. So it is measure of total amount of bilirubin that is circulating in the blood stream. So the total bilirubin, it can be measured through blood test. The most common method is dye-azo test. The reticulocytes, they are elevated, indicating increased red blood cell production. So the elevated reticulocyte count means that there is increase in number of immature RBC in the bloodstream. So these reticulocytes, they are produced by bone marrow and they are released in the bloodstream to replace old damaged RBCs. So an elevated reticulocytes may indicate that body is responding to anemia or blood loss, as the bone marrow produces more RBCs to compensate for the loss. So it is seen in condition like hemolytic anemia, where the red blood cells, they are destroyed faster than they can replace, and in some case of iron deficiency anemia. The hemoglobin and hematocrit levels may be decreased due to increased red blood cells breakdown. So the reticulocytes count, they can be measured through the blood test and they are usually reported as percentage of total number of RBCs. A decrease in hematocrit and haptoglobin level. So hematocrit is the measure of the percentage of the RBC in the blood. A decreased hematocrit means there are fewer red blood cells than the normal. That can indicate anemia. Hemolytic anemia is the type of anemia in which RBCs, they are destroyed faster than they can be produced. So that lead to decrease in hematocrit. Haptoglobin, it is a protein that is produced by liver that binds to hemoglobin, a molecule inside the RBC that carries oxygen. So when the RBCs, they are destroyed, hemoglobin, it is released in blood, and haptoglobin, it binds to it to prevent it from causing damage to the kidney. A decrease in the haptoglobin level will indicate there is increased destruction of RBCs, as there is more hemoglobin in the bloodstream that needs to be bound. So a decrease in hematocrit and haptoglobin level, it will be sign of hemolysis, that is the destruction of RBCs. Whereas in the obstructive jaundice, you will see the total bilirubin level, they are elevated with the predominance of the conjugated bilirubin. The LFT, they are abnormal with elevated level of alkaline phosphatase, gamma glutyl transferase and transaminase. In the hepatocellular jaundice, the total bilirubin level, they are usually elevated with both the conjugated and the unconjugated. The LFT are usually normal with elevated level of transaminase, alkaline phosphatase and bilirubin. So in case of hepatocellular jaundice, we can do test for the viral hepatitis like hepatitis B surface antigen, anti-hepatitis C virus antibodies. They can help detect the cause of the liver damage. The urobilinogen, it is a byproduct of the bilirubin, and in case of hemolytic jaundice, a small amount of urobilinogen is excreted in urine. So in the hemolytic anemia, there may be increased breakdown of RBC that causes increase in the bilirubin level, and there is increase in the urobilinogen level in the urine. So this increase in the urobilinogen level in the urine, it may be a sign of hemolytic anemia. However, remember, it is not a definitive diagnostic test. So additional test and evaluation may be needed to confirm the diagnosis. So this is a table representing the difference between the three types of the jaundice. So serum bilirubin, it is usually unconjugated form in the hemolytic, whereas it is mixed form, both conjugated and unconjugated in the hepatocellular, and in the obstructive jaundice, it is predominantly conjugated.